The Bureau of Labor Statistics projects that each year nearly 176,000 nursing jobs are left vacant because of retirements. Recently, a three-day strike involving nurses across Minnesota ended Thursday. Many states, including Wisconsin, are experiencing nursing shortages. News 8 Now's Rob Romano spoke to Gunderson health officials about the issue. Good evening, Rob.
Good evening, Ken. A high-level recruiter at Gunderson Health says the pandemic has made recruiting for nurses more competitive. Chet Deering, a registered nurse and director of recruitment and talent strategy at Gunderson Health, says even before the pandemic, there was a shortage of nurses in our area because there just wasn't enough graduates.
And then in addition, we also have seen that the aging nursing workforce has contributed to, some of the larger percentages of unfilled positions.
Gunderson is experiencing an estimated staffing shortage of 10 to 14% among nurses, according to officials.
A lot of opportunities to make improvements there, but we also feel, reassurance that we're moving in the right direction, especially when we compare that to kind of upper Midwest as well as national industry standards.
Deering says there are about 2,000 nursing positions at Gunderson. Mary Ellen Stolder is the dean of the College of Nursing and Health at Viterbo University. She worked as a nurse for years before working in academia, and she says the profession is hurting overall.
Nationwide, I believe it's about 20% of nurses have left their positions during the pandemic. And a significant minority of individuals have indicated that they intend to leave nursing earlier than they planned.
Stolder adds that the nurses of today are being called upon to do even more than in previous years.
They are confronting not only staff shortages, but supply shortages that affect their ability to practice. And also, we need to take measure of the looming mental health crisis, where individuals in our country do not have access to mental health services, and the hospital is their primary source of psychiatric and behavioral health treatment.
Gunderson is trying to incentivize nurses to help with the staffing shortage. The health system has a talent referral program for registered nurses. If one registered nurse refers another to the company, the referring nurse could get paid $5,000 if the new hire is successful. Ken, back to you.
All right, Rob Romano, thanks very much. We're told that no union is active at Gunderson for registered nurses or licensed practical nurses at this time. However, one union is currently active for nurses' aides.